everyone, this is Belinda Dow. I am a registered dietitian. Welcome to my channel. If you are watching this video, you are probably struggling with your weight and wondering why no matter what you do, you can't seem to reduce it. So before I get into our topic today on how to know if you are insulin resistant and how stress can contribute to becoming insulin resistant, click the subscribe button, like and comments if you have anything to add to this video. You can also message me personally if you are looking for specific answers or need maybe some guidance in whatever it is that you might be going through. So for just a bit of a recap of what insulin resistance is. So insulin resistance is when cells in your muscles, fats, and liver do not respond well to insulin and can't use the glucose from your blood for energy. So what happens is that to make up for it, your pancreas makes more insulin to try and to metabolize the glucose, and this over time causes your pancreas to overwork itself due to the excess production of insulin. And eventually that's going to end up in a higher blood sugar level. So insulin resistance or metabolic syndrome usually has a couple points of criteria that you need to watch out for. And if you fit into the following factors, you might want to get a blood test done and make sure your blood work is normal. If you have already done a blood test and it fits into the criteria I'm about to explain, then further testing may be necessary in this case. So the following: if you have a waistline of 40 inches in men and 35 inches in women, if your blood pressure readings are of 130/80 or higher, if you have a fasting glucose level of over 100 mg per deciliter, if you have a fasting triglyceride level of over 150 milligrams per deciliter, and if you have an HDL cholesterol level of under 40 mg per deciliter in men and 50 mg per deciliter in women. You also may realize on your skin, there may be skin tags there. You might realize patches of a dark velvety skin in, like, let's say around your neck, around your elbows. So now these are standard if you want textbook criteria for insulin resistance and metabolic syndrome. However, it's actually not that simple and to the point, and that is what I'm going to explain in this video. So to tell you a little bit about my personal story of how I became insulin resistant and how I discovered I was insulin resistant. So it actually took me exactly 9 months to get a proper diagnosis. This was also after going through a whole bunch of blood tests 2 years prior to that actual diagnosis. So if you want, plus the 9 months. So I went to multiple doctors. I did all the tests you can possibly do, and nothing showed up in those 2 years except for a higher cortisol level, which I will get into later. But basically, every doctor I saw always only requested I do a fasting glucose test. And from there, if that test shows any abnormal numbers, the doctor will, suggest that you go on to do further testing. However, my personal experience, it really isn't that simple. And rarely will a doctor take that further step to ask you for more tests if your blood glucose levels appear to be normal from a blood test. And this is why it's important for you to pick up not only take your test results into consideration, but also to pick up on the signs and symptoms that you could maybe possibly be experiencing, and kind of just, listen to your body at times where you're not sure what's wrong, but you sense that your body doesn't quite feel like it's at its optimal state. And so to answer the question you are probably all wondering is, if my blood sugar levels are normal, then how and why would I even think that I'm insulin resistant, or how could I be insulin resistant if my blood sugar levels are normal? So you can be insulin resistant and have a normal blood sugar level, even a low blood sugar level. And this is why it's very important to make sure you get a blood test done for your insulin levels, your glucose levels, and your cortisol levels. So those are three very important tests that need to be done in order for you to actually get the proper information of if you are insulin resistant or not. So if all three tests are normal, usually you're in the clear. However, sometimes it requires that extra step where an oral glucose tolerance test should be done. And I say this because this is where you can actually monitor and see how insulin is reacting with sugar consumption. And a blood glucose test, a fasting blood glucose test, is not going to show that. So what happens in this test is that you get a fasting blood glucose done first, as well as your fasting insulin. And then after that, you're required to drink a sugary solution of what usually is 75 grams of pure glucose. So after that, another insulin and glucose test is done after an hour of the sugary solution in order to see how your body is metabolizing the sugar you just had. And then the test is repeated again after 2 hours. So this test allows you to see insulin levels react. And this can be an indicator of insulin resistance if you see that your insulin levels appear high after an hour and then even higher after 2 hours. So this tends to show that your body is struggling to actually allow that glucose into your cells. And so when you have those higher levels, if you want the higher insulin levels above reference range, this actually means that, like I said, your body is struggling to allow glucose into the cells, which in return means that your pancreas is producing more insulin. And because the initial insulin produced for the 75 grams of glucose that you had, it's not being able to bind with those insulin receptors, and that in return allows glucose into your cells. And this can definitely be an indicator of insulin resistance. So the thing is, a lot of doctors will not ask you to do this test if they see that your glucose levels are within normal range, because they usually associate it with pre-diabetes. And if your glucose levels are normal, so this is where the misdiagnosis or the no diagnosis can be obtained. And that in return leaves you wondering, why are all my tests normal, but my weight is stuck, or I'm gaining weight and I don't know why or how? So you could be doing everything right, you could be working out and sleeping right, but your weight just won't budge. So, and this is exactly what happened to me. It took me 9 months to finally get that proper diagnosis of what it was I was going through. And in 9 months, I saw so many doctors, and each one had their, if you want, their own interpretation or their own diagnosis, except for the actual accurate diagnosis, which is insulin resistance. So it was only up until I saw a doctor specialized in insulin resistance that I actually got the proper diagnosis and actually figured out, what was actually wrong with me. Although at the time I didn't know for sure that if it was insulin resistance or not, but as I'm being dietitian, I'm familiar with these topics, and the symptoms had always made me consider the possibility that it was related, obviously, to an insulin and glucose levels fluctuating. So during those 9 months, every time I ate, 2 hours after my meal, I would experience a hypoglycemic episode, which is usually a low blood sugar level or a drop in your blood sugar level. So I would go through 20-30 minutes, fast heartbeats, blurry vision, shaking and numbness in the hands and the feet, and I would lose focus and concentration. and I would feel exhausted all the time, and just in that time it would be such a tired feeling. And then there's also faintness and the inability to stand or sit. So I'd feel like I just have to lie down and close my eyes and deal with, fight off the feeling, because at the time I didn't really understand what it was that I had to do to feel better. I didn't understand what was happening, but I realized that it was 2 or 3 hours after I ate, so I associate it with my glucose and insulin levels. And the thing is that even describing my symptoms to doctors, they never assumed it was a reaction to a high insulin level or even a hypoglycemic episode. So the doctor that finally diagnosed me properly asked for the glucose tolerance test that I mentioned before. And this is why I say this test is super important, because it was when I did that test, you could see my insulin levels remaining high after an hour, and then it became even higher after 2 hours, meaning that my pancreas was demanding more insulin in order to accommodate and let that glucose in. So you can see here my glucose tolerance test that was done. This was 2018 when I was first diagnosed. And what's so interesting is that most people, physicians and specialists, would be surprised that my glucose levels were normal and my insulin wasn't. So the things that people tend to always relate insulin resistance to prediabetes, and that actually isn't always the case. And that's why it was quite interesting and quite shocking to some doctors. So it's like my body was telling me something is wrong, and I knew there was something wrong, because the 9 months, of experiencing hypoglycemic episodes every time I ate, I needed to find out what it was causing this reaction, and then having done all those blood tests before that to try to figure out what the problem was. So yeah, you can say I went through so many tests, and nothing stood out except for the cortisol level. That was a bit higher than the range, and this should have also been something the doctors picked up on, because there is a relation between cortisol and insulin, and that didn't register with any of the doctors that I saw, that this could possibly be due to insulin resistance. And like I said, there is a significant relationship between high cortisol levels and insulin resistance. And I will get into another video explaining how they are related and how they affect each other, because it's actually very interesting how the two kind of come together. So if one is high, usually the other one is high as well. So I will get into that in a separate video, so I don't make this video too long. The thing is that at that time in my life, I had been going through a lot of stress in my life, and this was the, if you want, initial reason that led me into insulin resistance. And I was always someone who took care of my health, my food, my exercise, and I went to the gym almost every day. I stayed away from junk food. I kept a normal range weight, and however, the phase I did go through when I was under a lot of stress and I fell into somewhat of a depression, I remember feeling like my body had just suddenly stopped working. It's very strange. I just felt like nothing I did would affect it or change the situation it was in, almost like a trauma effect to the body. And that's when I started to gain weight, no matter what I ate, no matter how many times I went to the gym and worked out, and no matter how much I worked on my health and my diet, nothing would change. And that was when I started to do all those tests, just to understand why my weight wasn't changing at all. And it was very frustrating. Although at the time I just had a couple of kilos that I wanted to lose, probably added on from the holidays or something, I don't remember, but I wanted to just reduce those couple of kilos, so it started out as something that wasn't a big deal, because I'm a dietitian, I know exactly what to do, I know exactly how to lose weight, and then I started to realize that no matter what I did, no matter what diet I went on, no matter how much exercise I did, it just would not go down. And that's where I knew, okay, something's wrong, something hormonally might be off. And then doing all those tests, nothing showed up in my blood tests, except, like I said, the cortisol level. And because I was going through a very hard time emotionally and mentally, I assumed it was just stress. So I didn't necessarily relate my cortisol level to insulin resistance at the time. I knew the stress I was under. But then unfortunately, my weight kept going up. You can say in 2 years' time, I was up 25 kilograms from my initial weight at the time of that stressful period. And, you know, that stressful phase went on for 4 years. I'm not going to get into the details of why I was so stressed, but it was a very traumatic time for me. And, you know, it took a toll on me. It took a toll on me heavily. So, when I was diagnosed with insulin resistance, I knew it was because of those 4 years, because, you know, ever since that phase, my body, like I said, just stopped working with me, and my weight just kept going up. And that's where insulin resistance got worse and worse, I believe, because my weight kept going up, and as well as the stress levels, and, you know, weight and stress adding on is just going to add more weight on. So 4 years down the road with the stress and the weight gain, I couldn't recognize myself anymore. And that just added more stress to my body. It was very frustrating and, you know, just very depressing for me. It was so difficult to have to accept myself with all the added weight, and dealing with getting myself out of the depression I was in to begin with. So yeah, when I had decided to move to Dubai, I was trying to start a new page of my life, trying to work on putting all my energy and effort into, you know, getting my body back, getting myself back, in all aspects. And it was when I moved to Dubai that I began experiencing those hypoglycemic episodes. And it was when I had decided to go on a super low carbohydrate diet. And this is really important, and I will also get into a video for just about low carb diets and insulin resistance, because a lot of people don't know this, and it's super important to be aware of it. So basically what you can say is that the low carb diet pushed me over the edge of insulin resistance, and that's when I started experiencing those hypoglycemic episodes. So I think it was the, you know, the push over the edge. So long story short, I finally got the right medication, which was Glucophage XR, and it helped regulate my insulin levels. And this also helped me reduce the constant hunger I always felt. And insulin resistance is a very vicious cycle, as I've mentioned before, because it does not allow glucose to enter your cells, if you want, in the correct manner. And this keeps your cells hungry and craving sugar and carbohydrates. And this doesn't help in restricting or allowing yourself to be on a low carb diet to begin with. It's almost impossible to be on a low calorie diet. I would have a meal and then end up feeling hungry an hour later, as if I had no food at all. And this is exhausting, and it exhausts your body because your insulin and your glucose levels are all over the place. And my energy was always so low. It was a struggle to maintain a normal amount of food, but also to maintain a stable glucose level every time I ate. So it was a battle of whether to eat or not, and how that is going to affect those hypoglycemic episodes. And if I didn't eat, I would literally feel my body being deprived of carbohydrates, and eventually it would end up in a glycemic episode after a couple of hours after that meal. So, you know, as you can see, your glucose levels can be in normal range, perfect even. Mine were perfect, and they were even sometimes lower than the normal range because of the hypoglycemic episodes, because of the excess insulin in my blood. And you can still be insulin resistant even with a normal blood sugar level. And you know, that tends to happen when we are insulin resistant and also hyperinsulinemic. So that's also something to watch out for. It also goes to show that, you know, you could have a healthy weight, you could maintain physical activity in your daily routine, thinking that you are healthy, thinking that everything's fine, but you could still have insulin resistance if you, you know, are exposed to, if you want, a great amount of stress or trauma. And, you know, some studies have actually showed that insulin resistance can occur from suppressed anger and sadness. So this is also something to be aware of, and I think this was my case and scenario. And this is why I really say this with all my heart, that if you have some sort of stress or trauma in your life, remember that your health comes first. So do not allow anything to affect you or take away from your well-being. It's not worth it. Nothing is worth it. So you know, unfortunately, I realized that too late. And I try to remind myself all the time. Anytime I'm stressed out or upset about something, I try to remind myself that life goes on. So don't allow that stress to really, you know, get inside you and actually do more harm than what you think it's doing. And I remember and I have to keep reminding myself to just love myself more than anything and keep my body healthy, because at the end of the day, that's the only thing that actually matters, you know? So I'm still struggling with insulin resistance, and I still need to remind myself and, you know, feed myself that positivity every day. But, you know, just be aware of how stress can affect your body, and try to do things that will reduce that stress, and just allow you to remember that the most important thing is you. So, you know, go out of your way to do things that actually relieve your stress. Yeah, I will add more videos on insulin resistance, of course, and I will take you on my journey with it. I will also add videos of the topics I mentioned earlier along the way of my insulin resistance episodes. So subscribe, hit the notification button, and stay tuned for more videos. I really, really hope this video was helpful, and I hope this video, I hope I'm able to bring awareness to anyone out there who maybe suspects there might be something off with their body or their energy levels, and you know, isn't really quite sure what it is. So please make sure you rule out insulin resistance. Thank you.